In the past decade, we have learned much about wounds, and currently most clinical facilities utilize standard risk assessment guidelines to prevent skin breakdown and promote wound healing. Despite the increased awareness, nearly 60,000 U.S. patients are estimated to die each year due to complication from pressure ulcers. The average incremental cost of treating a pressure ulcer is estimated to be over $40,000 per case. This is a major challenge in the healthcare industry that requires innovative solutions. A major contributing factor of chronic wounds is prolonged exposure to moisture. When skin is exposed to moisture-based irritants, such as perspiration, urine, liquid stool, and exudate, the irritants penetrate the skin and cause skin inflammation. This can lead to cracking of the skin and ultimately skin erosion. Managing skin moisture is a critical factor in maintaining skin integrity. In an effort to aid caregivers in managing exposure to moisture, Medline has developed an innovative product solution: ultrasorb's AP Dry Pads. The power of one pad for dryness, breathability, and strength means better skin health. When you use an underpad, it's essential that it not only protects the bedding, but also protects the skin from the damaging effects of incontinence and fluid drainage. Medline is proud to introduce the advanced technology of ultrasorb's AP, a unique underpad that absorbs and locks away moisture, breathes to help reduce heat buildup, and is strong enough to resist ripping or tearing. ultrasorb's AP allows air to flow through, and nothing else. They are constructed of 4 layers. The nonwoven top sheet is soft against the skin for increased comfort. The highly absorbent thermobonded supercore wicks moisture away from the skin and locks fluid away for increased patient dignity and better skin care. The core does not bunch up like traditional disposable underpads. The AquaShield film traps moisture while allowing air to flow through, providing breathability and leakage protection. And the innovative backsheet provides exceptional strength for ease of use by the care provider. ultrasorb's AP dry pads hold up to 1 liter or 4 cups of fluid. This is a staggering amount of fluid in comparison with traditional underpads. A typical void is between 250 to 350 cc. To demonstrate the dryness of ultrasorb's AP, we will pour 300 cc's, or approximately 1 cup of fluid, into a traditional underpad, a breathable underpad, and the ultrasorb's AP. After waiting 7 minutes for each product to absorb the fluid, we'll assess their dryness. By touching each underpad with a white cotton glove, we'll see how well each product locks fluid in the pad and stays dry against the skin. The typical reusable underpad is still wet. The typical breathable underpad is still wet. However, ultrasorb's AP is dry to the touch. Again, the reusable underpad is still wet. The breathable underpad is still wet, but ultrasorb's AP is dry to the touch. And remember, you get these results by using just one ultrasorb's AP pad. Stacking multiple pads is not only unnecessary, it can increase pressure against the skin of the user. Another common disadvantage of traditional breathable underpads is that they can leak through the backsheet and soil the surface beneath. When a weight is placed on top of a traditional breathable underpad, we can see how the fluid is forced out of the underpad and onto the surface below. When the same weight is placed on an ultrasorb's AP dry pad, there's no strike-through. ultrasorb's AP prevents leakage to the surface below. Again, there is strike-through on the traditional breathable underpad and no strike-through on ultrasorb's AP. Another great advantage of ultrasorb's AP is its breathability. ultrasorb's AP can be used on any surface, including a low air loss bed, to help keep air flowing through to the skin. Traditional breathable underpads can leak through the back when under pressure, increasing the likelihood of contaminating the surrounding environment. You won't have that problem with ultrasorb's AP. These unique dry pads are both breathable and effective in eliminating strike-through under pressure. To demonstrate the breathability of ultrasorb's AP, we'll place its breathable backsheet over a container full of steaming water. The steam shows that the warm air below is able to pass through the breathable backsheet and create condensation on the glass. When a plastic backsheet from a traditional underpad is placed over the container, we can see that the water vapor does not pass through. This lack of breathability can help increase the incidence of skin breakdown when using a traditional underpad. The correct way to use ultrasorb's AP is to place one dry pad on the surface with the printed side down and put the folded edges across the width of the bed. This arrangement provides the most coverage and is also the proper direction if the pad is to be used for repositioning. Because ultrasorb's AP is made from a strong material and resists tearing, it can be used for repositioning. To reposition with ultrasorb's AP, firmly grasp the material at each corner of the underpad to create two handles. This distributes the weight, then use to reposition the user side to side. Please note, ultrasorb's AP is not to be used as a patient lifting or transferring device. Please follow your facility's proper procedures and protocol for lifting or transferring patients in order to reduce risk of injury. ultrasorb's AP dry pads are the logical choice for better skin health. The combination of dryness, breathability, and strength not only make ultrasorbs cost-effective, but also a great choice for patient care.